Did you know that you could be doing everything right, having regular periods, no pain during cycles, and yet have some hidden problems that are stopping you from achieving a pregnancy? Now let's talk about what these hidden problems could be. Silent gynecological conditions exist in your uterus, tubes, pelvis without causing any obvious symptoms like pain during periods or heavy cycles, yet they might be quietly interfering with the chances of achieving conception. Conditions such as mild endometriosis, wherein the uterine lining it gets deposited outside the uterine cavity over the tubes, ovaries, or even sometimes the intestines, might affect the pregnancy chances. There are various other silent conditions like small uterine fibroids or uterine structure abnormalities which could be congenital or acquired, blocked fallopian tubes that can often happen because of silent tuberculosis or infections, and many other chronic low-grade infections do not cause obvious symptoms but still deplete your chances of achieving a pregnancy. Many women believe that having regular cycles means everything is healthy, but there are many other conditions which need to happen physiologically normal. That is, an egg pickup by the fallopian tubes, the sperm movement, the implantation process, and a healthy uterine environment. Now, all these factors need to be normal for you to achieve a pregnancy. These silent problems often affect the fertility by interfering with the movement of the sperms, preventing the egg and sperm from meeting with each other, by disturbing the chances of the implantation of an embryo, and also causing inflammation in the uterus, which might affect the continuation of a healthy pregnancy. These issues often go missed even after performing a routine ultrasound and basic blood tests. So what we really need are the advanced tests or procedures where we might be able to identify these hidden causes. Now, unfortunately, many of these advanced tests or procedures are usually done in women after having repeated failures. Women should suspect the presence of these hidden problems if they have been trying to conceive over a year in women under the age of 35 years and over 6 months in women above 35 years of age, or if they have history of any repeated miscarriages or past history of failed fertility treatments. Now, what is the solution that we have? We have advanced tests like an advanced ultrasound would include a 3D ultrasound. That means a three-dimensional construction of your uterine cavity to detect the presence of any structural abnormalities if present, or even if there are small uterine fibroids, are they compressing the cavity and interfering with the chances of a pregnancy. Now, second, we have a hysteroscopy. Now, hysteroscopy is again giving you extra pointers because on an ultrasound, a routine ultrasound, you cannot visualize the interior aspect of a uterus. On the other hand, if you are performing a hysteroscopy, a camera is introduced into your uterine cavity to visualize the inside of the uterus. We can pick up certain conditions like chronic endometritis, which might be affecting pregnancy chances in women with no other possible symptoms. Then we have a laparoscopy, wherein in a diagnostic laparoscopy, the camera will be introduced to see the inside of your abdominal cavity. We can pick up any presence of mild endometriosis, wherein the uterine lining is deposited on the outside aspect of the uterus, on the tubes or the intestines, which can be corrected so that your symptoms or the possible chances of pregnancy will be improved. And the most important message is that once these problems are identified, most of them are actually manageable, and early diagnosis significantly improves the chances of a pregnancy. If you have been trying quietly and struggling, it may be time to look deeper and seek help.